Hello and welcome to this India Today special, where we are going to look at what we are describing as the hospital horror in Goa. That's right, tiny Goa, a tourist idyll, is today facing its corona crisis moment. More than 75 people have died, allegedly because of oxygen supply fluctuating in the state's leading hospital. Today, the government, which has been silent so far, finally appeared to wake up and said that they were installing a new cryogenic facility, a 20,000 litre liquid oxygen plant that would ensure continuous supply to the hospital. In a moment, we'll be joined by top doctors from Goa, but before that, take a look at this special story from Saurabh Vaktania. Is it too little, too late?
This is the Goa Medical College, which has become a hospital of horrors. Every day and every night, patients infected with COVID lose their lives due to erratic oxygen supply. This is the exact location where oxygen cylinders are loaded in trolleys and then brought to the hospital in tractors. It's alleged that tractor drivers are finding it difficult to maneuver.
These are the tractors on which the trolleys are attached, and on those trolleys, these are the oxygen cylinders. Now continuously several rounds are made through these tractors. Oxygen cylinders are brought into this Goa Medical College Hospital.
That's not all. This is your worst nightmare turning into reality. Oxygen does not even reach the COVID wards.
The oxygen pipes are several years old, and therefore the oxygen does not supply to the third and fourth floor properly, and the oxygen level several times goes down, which is when the patients die.
So how is oxygen being supplied to this hospital? First, Scoop Industries Private Limited, a private firm, is the supplier. The refilling plant of the firm is at Korlim, which is 15 kilometers away from the hospital. The oxygen is brought to the hospital in tractors and trolleys under police protection. Facing unprecedented heat from the opposition over the string of deaths, the Goa government has finally broken its silence. Goa's Health Minister Vishwajit Rane has said that 350 patients are shifted from the old GMC building to the new super speciality hospital. Earlier, the health minister had said that the super speciality hospital will be commissioned. He then retracted from that statement after India Today's report and now claims that it's already functional. He also assured the setting up of a 20,000 litre oxygen plant in the hospital as early as on Saturday itself.
Most important part of this tweet was Goa's Health Minister Rane is appealing to the Chief Minister Pramod Sawant to commission this block. So, even if this place is still not commissioned, 350 people, 350 COVID patients have been shifted over here. So what is the government waiting for to commission this hospital? And is there no coordination between the health minister and the chief minister?
But the opposition is unimpressed, directly blaming the chief minister for the fatalities.
If I am suppose that health minister also wants record earlier saying that the maintenance needs to be done. The maintenance is taken care by the GSIDC, which is Goa State Infrastructural Development Corporation, which is headed again by the chief minister. I don't know what is GSIDC doing.
It's taken scores of deaths for the Goa government to wake up. But even so, the situation continues to remain grim and there are no major changes on the ground as yet. With Saurabh Vaktania in Panaji, Bureau Report, India Today.
Now, until now, the Goa Chief Minister Pramod Sawant and the Health Minister Vishwajit Rane had been refusing to take questions, particularly from India Today, as we kept pressing them on what was happening in the hospital. This evening they had a press conference. Pramod Sawant said all was well. Not all deaths were related, he claimed, to oxygen supply. Listen into what he claimed would now be done by the Goa government.
A cryogenic tank which is of the 6,000 किलोलीटर टैंक, वो हमारी खुद की नया अस्पताल था, उसके लिए हमने प्रोविजन पहले से किया था. The second tank, which is in super speciality, one of the state of the art facilities जो हमने प्रधानमंत्री केयर फंड्स के अंतर्गत से हमने जो कंस्ट्रक्शन करके कंप्लीट किया था, थोड़ा बहुत इनकम्प्लीट करने में बाकी बचा था, फिर भी कोविड के वास्ते इस विदाउट इनॉग्रेशन वी हैव स्टार्टेड और एट प्रेजेंट मोर देन 300 पेशेंट 350 पेशेंट्स वी हैव शिफ्टेड फ्रॉम द ओल्ड जीएमसी टू द न्यू सुपर स्पेशलिटी। और वहाँ पे even though along with the ICU, along with the even though HFNO2 high nasal flow oxygen की फैसिलिटीज वहाँ पे अवेलेबल हैं और वहाँ पे जो टैंक अवेलेबल है वो 20 किलोलीटर की टैंक वहाँ पे हमारे पास अवेलेबल है।
Is it too little, too late? Did it require a crisis like this for the Goa government to wake up? What has gone wrong with Goa, which traditionally has a reputation for providing decent health care? Joining me now are four top doctors. Dr. Oscar Rebello, Goa's leading medical practitioner, joins me. I appreciate your joining us. Dr. Sandeep Naik is spokesperson of the Indian Medical Association in Goa. Dr. Joseph Brito, pediatrician and someone who has managed hospitals in the West in the past. Dr. Pratik Sawant is president, Goa Association of Resident Doctors. Thank you all very much for joining me. Dr. Oscar Rebello, is this a man-made tragedy? Is this something that could have been avoided?
Rajdeep, I'd like to look at this from three angles. One is the scientific angle, the second is the social angle, and the third is the political angle. From the scientific angle point of view, because I've been dealing with COVID patients for the last 1 year now, going into the wards and seeing them, we've never seen something like this as compared to the last time. This has been a relentless wave. They have serious patients with terrible lung diseases. So in essence, I still cannot fathom what is the scientific reason why a population like Goa, which is 1.5 million, which is equivalent to the population of Dharavi in Bombay, why should we have had so many cases and so many severe cases and still counting? 3,000, 4,000 cases a day when Bombay has been reporting 6,000, 7,000. I can't wrap my brain around this scientific fact of how we've been hit by a terrible mutant. So I don't know whether there is a mixture of mutants, but that's for another day, that's for another scientific story. The second is the social factors relating to this COVID crisis, Rajdeep. And there I think typically being Goans and typically being laissez-faire and typically being disobedient and indisciplined, I think we just had a party. We were in a complete party mode when the whole country was already reeling with the COVID crisis. So not just in West Bengal and not just in the Kumbh Mela, but we were having political rallies and festivals in Goa here, dime a dozen, and everyone was throwing caution to the winds. And I think that has triggered this huge crisis in a very big way. And the third, of course, is the political crisis, which I think has led to what has now been discussed as the dark hour and as, the oxygen crisis, which has, of course, affected the whole of the country, because this, as I told you, has been a relentless ferocity of this wave that has come in. But fundamentally, I think, Rajdeep, I do not think, but I'm really disappointed, because in the first wave, I was there on the expert committee and I saw that there were efforts being made to put systems in place. But during this second wave, everybody got their eye off the ball. The chief minister, the health minister, they are scoring brownie points. They are trying to get onto political one-upmanship. They are just trying to play to the gallery, and this is not the time. For God's sake, there are people dying, there are people suffering. This is not a funny disease. There are people in absolute misery here, and they're really crying out for some kind of solace. And if the political leadership does not give you solace, all that it requires is solace. You may not come up with the greatest of the most fantastic of scientific ideas. Yes, you've got the oxygen tanks now in. You've managed to get the oxygen cylinders in. You're working at the High Court directives. Of course, you're putting all these things in action. But you must be working as a team. You must be both with your hands at the wheel and driving this car in the right direction. This is what the people of Goa are absolutely astounded, bewildered, and so furious about, with this political leadership playing their political games while people are dying. I think that is the nub of the problem.
Before I go to my other guests, I just want to understand though, do you still believe, you mentioned three factors, the scientific factor, the social factor, the political factor, but the medical factor, when our reporter Saurabh Bhaktania is showing how tractor trolleys are being used in today's times to take the oxygen cylinders through very old pipelines to the point where they are not even able to reach some of the COVID wards. What does that say? Could we not have been better prepared, Dr. Ribello, that point, that therefore between 2 a.m. and 6 a.m., if this was linked to oxygen supply, surely we should have had modern oxygen plants in place, given the fact that Goa prides itself on its healthcare?
Correct, Rajdeep. You must have been at the Goa Medical College and you've seen how sprawling the place is. This place was never really designed for, an ICU center where you have one oxygen tank or a huge oxygen tank that provides you piped oxygen to, just the ICU or the SICU. You have these huge corridors in which these pipes just run around for kilometers and kilometers, and clearly, therefore, you require oxygen, the oxygen cylinders to provide you the oxygen to the patient at the bedside. And this is where the problem is. And this should have been envisaged. This should have been seen as going to be a kind of a problem that's going to come and hit us in the face. And I think we were not prepared for this. The South Goa District Hospital, being a modern hospital, the tertiary super speciality block being a modern hospital, has been designed as such. The old GMC has not been designed to take this kind of oxygen load through a piped system, through the regular modern system, and it has to go through these cylinders, which obviously then you come up with these lame excuses of trolleys and I don't know, drivers and not being able to maneuver and not being able to reverse. But yes, there has been an abject failure of not being able to understand where this crisis was. And the crisis was oxygen all along. I think the Goa Association of Resident Doctors president will be able to tell you that they had flagged this issue from many, many days ago, but somehow the eye was off the ball because there was politics and there was no focus on the pandemic, which is sad because there have been efforts made, but everything's come to naught because we have lost so many lives. This kind of death rate is almost unheard of in a population of 1.5 million.
I want to come to you, Dr. Sawant, of the Goa Resident Doctors Association. Did you flag it off? Did you flag off that these pipelines were old and creaking, that the oxygen supply would not work in the GMC if there was so much of pressure of patients? Did you all alert the Goa government, and what was the response, Dr. Sawant?
So we have had this pandemic mid-March, and the cases have been sprawling. If you go to look today, our positive cases are around 1,600 to 2,000, with the deaths around 58. We have crossed the 2,000 mark today. So around a month into the pandemic, our oxygen demands increased rapidly. The peak was, we never knew what was the peak. There was no signs of it plateauing. So we had returned to our institution. We had a word with all the government also that there were some problems. Finally, as residents, we do not look into the oxygen supply, the plants, the pipelines. What, as a resident doctor in the ward, what I see is what the patient gets. Finally, of all this, what a resident doctor or any doctor for that matter here wants is his patient to get his treatment and the oxygen to be delivered to him, whatever he requires. So we started noticing a few problems. There were the residents noted some lapses in central pressures, and there was some delay in getting the cylinders. There were a lot of bottlenecks. So we wanted to bring this issue because a resident doctor on a shift is 1 or 2, and with our wards sprawling around 30 to 45, if something
so what was the
levels go low.
So Dr. Sawant, what was the response? No, what did the authorities say?
So,
what did the authorities say when you flagged this off, that there was a problem? What did they say?
Yeah, so the first thing that I would like to say is after we met the authorities there, then there was talk about it. Then there were videos going about how the oxygen patients telling their tales. The authorities also started understanding the problem. They accepted it. That's the most important thing. To be honest, all of us were caught off guard. For a population of 15 lakhs, we have never seen daily deaths of around 50 to 70. Resident doctor in his shift has never seen 4 or 5 deaths just happening, not being able to help. Yeah, so they took up the issue. After that,
so
we could not still meet the we could not.
So you're saying
to be,
okay. So Okay, you're saying you could not meet that sheer demand. You all were all taken off guard. Dr. Brito, what does this say about hospital management? You know, you have a sprawling hospital, the biggest hospital in the state that caters to almost, what, 3 in every 4 patients in a way in a small state like Goa would perhaps use this hospital, and yet it did not have the kind of modern facilities that you need. Now there's a super speciality hospital which has been commissioned earlier, which is now taking some of the patients. But clearly, a state like Goa was completely unprepared, it appears. What does it say about hospital management, Dr. Brito?
Rajdeep, thank you.
And political governance.
This should not be happening. This should not be happening. Goa is a small state. Not only do we have a population of 15 lakhs, we have a geographical area of just 3,700 square kilometers, but we are India's richest state by per capita GDP. This should not be happening. The story, of course, unfortunately, isn't new. It's not something that happened last week or last month. Look at the data. If you look at the positive cases per 100,000, the per capita new cases in Goa and the deaths per 100,000 have been the highest in the country, higher than even Delhi and Bombay. Coming to the specific point that you raise of oxygen, you know, one of the aphorisms we are taught in medicine is when there's a crisis is to call for help. We should be shouting for help. We should be shouting to neighboring states, to the central government. We should be co-opting the army and the navy, which have significant presence here in Goa, to take over tonight, to take over the logistics of the supply of oxygen to private and public hospitals in Goa. But Rajdeep, oxygen is just one piece. It's not just oxygen. We will never have enough oxygen. We will never have enough hospital beds, ventilators, and the trained medical and clinical personnel. The only way, the little solace to those who have lost their loved ones, but the only way, Rajdeep, to stall this pandemic and prevent the next pandemic is vaccination. For every vaccine that's sitting on a shelf in Goa tonight, there's one person who has not received the vaccine, who in 2 to 3 weeks' time, when they do come across the infection, their chances are 70% improved. They're less likely to enter hospital by 70%. We should be vaccinating round the clock, 24/7. Just like hospitals work on shifts, we should be vaccinating round the clock, by shift. We have to stop mopping the floor and we have to turn off the tap, Rajdeep.
You know, I take your point, because again, a small population where perhaps the vaccination drive should have been far more effective. Dr. Sandeep Naik, spokesperson IMA Goa, you know, Goa today is making the front page headlines nationally for the first time, perhaps for 4 consecutive days. Is the medical association, how are doctors seeing it from your point of view, when every morning you wake up to hear so many people have died allegedly because of oxygen shortage? Now the Goa medical authorities at the hospital are saying it's not oxygen shortage, but the health minister 3 days ago claimed it was oxygen shortage. So how are the doctors seeing it? It must be very, very frustrating for the doctors.
Yes, indeed, Rajdeep. Thank you very much for giving me the opportunity to talk. This thing has started for quite some time. It's not something which has happened overnight. And the handling of the entire health situation, right from the couple of years, in fact, has been a very different one from what you see in the rest of the country probably. Here you will see that almost everything has been managed by the health department. You will see a very peculiar situation where the ministers go around telling the doctors what to do. If they had left the doctors to do their duty and then do their own duty, as they say, like it's a logistics part, probably we would have been doing a better job. What is happening is that almost every decision which had to be taken by doctors has been taken by either the bureaucracy or the ministers. So what are the doctors left to be done? Now, just as the guard
in fact, the latest, to interrupt you, sorry to interrupt you, because I'm told the latest decision that has been taken is ivermectin will be made now compulsory or mandatory or be sold across Goa. Now, there is a dispute whether ivermectin is the right medicine to take, the right drug to take for COVID, but we are told the government of Goa has decided that. Has it decided it unilaterally? Did it consult the IMA or doctors like you?
No, not at all. That is the talk which is going on among all the members of the IMA right now. That who decides? We have always been told that some expert has said this, but we never know who is an expert. Probably Goa will be one of the few states where there is no task force, which includes doctors, especially from the private sector. So who decides all these things? If we were told exactly which expert panel has decided, then we would have participated in it, probably got down to the specifics of the dose, why it should be given, and then explained to the public accordingly, and then it would have been accepted. So all these things have been forced down the throat of practitioners, particularly the private sector. And now the latest has been that the government is actually trying to take over the private hospitals now. When the government cannot look after its own hospitals, how is it going to take care of the private hospitals?
I get what you're saying. Dr. Ribello, many people in the national capital or indeed across the country will wonder, why is a small state in such a big mess? In other states, the sheer numbers, the sheer volume of people, the large densely populated areas are really badly hit. Rural UP, rural Bihar with large populations, poor healthcare systems are badly hit. So therefore, people are surprised that Goa, has suffered in the way it has. So what's the big lesson? Is there a big learning, Dr. Ribello, that even small states can struggle in a crisis, in a pandemic?
Yes, I think so, Rajdeep, to a certain extent. But I go back to that little scientific thing that we are not looking at as yet. I still cannot wrap my brain around why we are seeing so many severe cases. Look, we are seeing severe pulmonary involvement, people on ventilators, people on NIVs, people dying at home because of drops in oxygen levels. So it's been a very severe pandemic in Goa. So have there been kind of multiple strains that have come in, the mutants that have come in, whether the UK mutant, the double mutant from Maharashtra? Because remember, Goa was an open house for everyone. So everyone from everywhere could come into Goa without a certificate, without an RT-PCR negative test. So God alone knows what has really been cooking here in Goa as far as giving us this pandemic is concerned. But it's really, really frightening to see that a state so well educated, so well resourced, with all the money in the world, and still we are struggling, and we are struggling bitterly because we are losing loved ones. And I don't think that lessons will be learned. I'm sure that lessons will not be learned, because that is the Indian way of doing things. We will cry hoarse when the crisis is there. We will weep, we will curse, we will yell. And then once, I expect this pandemic, we were 4,000 cases a week ago, we are 2,000 cases now. So I expect the pandemic, at least in Goa, to peter out in a couple of weeks. And then we'll go back to our bad old ways. You can be rest assured that we'll be back in the casinos, we'll be back in the clubs, we'll be back drinking, we'll be back gambling, we'll be back doing everything that is Goan, and then virtually saying, very virtuously saying to the world, we Goans are Jeep people, we are wonderful people, we are great people, and we will correct nothing until the next crisis, when we'll be back on your television show spewing venom all over again.
The age of Susegad surely is over. This is a wake-up call in a sense for Goa. Dr. Brito, very quickly, if there was one suggestion apart from vaccination that you're saying, that's for the immediate crisis. But for the larger crisis, when the world hears that oxygen cylinders are being carried on old tractor trolleys through old pipelines, they'll ask, where are modern systems? So if there is one quick lesson that you believe that Goans and indeed this country should learn now?
I wish there was one magic bullet. I think there's not one Gulliver answer. There are many Lilliput answers. So one is to increase our percentage of our GDP spent on healthcare. The major problem of oxygenation, I believe, can be solved by involving the army. It sounds radical, but if not now, when? In terms of vaccination, I think the country sadly is going down the pathway of every state negotiating with vaccine manufacturers. Yesterday, the government of India announced 2.16 billion doses will be produced in the country starting August, over 5 months. Whilst that number makes sense, that's 2 doses for 1 billion of our population. And should that happen, 76% of our country will be immunized. And by definition, we'll be lucky to have herd immunity. The devil, as always, is in the detail. We cannot take 5 months to vaccinate our nation. Come November, December, the areas of India that are under-vaccinated, viruses will be replicating. When this virus replicates, it mutates. Plus, we need to look at the efficacy. All vaccines are not equal where efficacy is concerned. We do need to look at the efficacy. The lesson from Seychelles is a salutary lesson for all of us involved in the decisions that are being made about vaccine procurement and purchase and production, which is, it was the highest percentage of any country in the world that was vaccinated, 60%, and yet they have a second surge and have entered a second lockdown. 57% of their vaccines came from Sinopharm. The other 43% came from the Serum Institute, the Covishield vaccine. So we do need to look at the efficacy of vaccines and have platforms that can adapt after gene sequencing, so that when there's a new variant, when there's a new strain emerging, the platform is able to re-engineer and update the vaccine.
Either way, we are looking ahead. Dr. Sawant, if there's very quickly, Dr. Sandeep Naik, you first. 30 seconds. What's the solution? Do you have a solution for Goa's crisis?
Yes, I think if the government allows the private sector to do its job and the government hospital employees to do their jobs, it would be the boon. And plus, we have to get out of this 1897 Act mentality where there is so much of suppression, and all these orders are taken out in the name of the President of India. But then at the local level, there's hardly any action from the government.
Right. So what effectively Goa is telling us is that we need better governance. Where Goa has clearly failed is medical governance. And I think it's been highlighted, there are political issues, there are social issues. We cannot break curfews all the time. Time of Susegad is over. We've got to wake up as citizenry. But at the end of the day, our leaders have to recognize that the right to life is fundamental, and they have to ensure high quality health infrastructure. Our soft underbelly of our health infrastructure has been exposed by the pandemic, including sadly in my home state of Goa. Not the ideal way for Goa to make the headlines, but then that's how it is. We'll continue to track this story, continue to put pressure till the health minister and the chief minister take our questions. It's time to be transparent and face the reality. Thank you all to my guests for joining us. Good night. Goodbye. Up ahead is a special with Dr. Devi Shetty. How should India prepare for COVID 3.0? You're watching India Today, India's channel for all the latest on COVID. Back in a moment.